entitled Lack of Perceived Risk of HIV Infection Among Key Populations, a Challenge for HIV Prevention Policy. Indonesia is the only one among 5 high-burden countries in Southeast Asia that have increasing incidence of HIV new cases. And the number of individuals involved in high-risk sexual practices is rocketing, while the message of using a condom is plummeting. And we all know that the rate of checking HIV and sexually transmitted infection in Indonesia is very low. This graph shows that, this graph shows that HIV new cases in Indonesia is increasing. This is the cross-sectional research, and this is only the preliminary result of our 6 months follow-up. We conducted the research on 70 treatment-naive HIV individuals, and they are also the newly HIV diagnosed. We collaborate with VCT clinics at 5 public health centers, mobile VCTs, and NGOs, 5 NGOs. And they all refer the patient to Dr. Ramalan Naval Hospital, Surabaya, and Sidoarjo Regency Government Hospital. We conducted the research from September 2013 to March 2014, and we are still doing the research until now. We use questionnaire to assess self-perceived risk, level of education, and knowledge of HIV. And then we use Fairman correlation. And this research has been approved by the Research Ethics Committee at Hang Tuah University, Dr. Ramalan Naval Hospital, and Sidoarjo Regency Government Hospital. Of the 70 respondents, 36% were female sex workers, 19% high-risk men, 24% men who have sex with men, 10% were transvestite, and 11% were housewives. 51.4% of respondents were males and 48.6% were females. Mean age of respondents were 34.4 years, and the youngest was 19 years old. Education. Majority of our respondents had senior high school education, followed by elementary school or illiterate, and then junior high school, and only 5 respondents had college or university education. When we asked about awareness of HIV risk, 44% respondents said that they didn't aware, and 56% reported that they aware of HIV risk. When we ask about knowledge on HIV, the cause of HIV, how HIV transmitted, and how to prevent HIV, majority of respondents have good knowledge, and around 26% have medium knowledge, and 25% have poor knowledge. Majority of housewives, high-risk men, and men who have sex with men, also transvestite, had high school level of education. 65.4% of female sex workers had elementary school level or had been illiterate. All housewives and female sex workers lack of comprehensive knowledge of HIV. 45.8% of respondents had been aware of their risk of HIV infection, and all respondents neglected to use a condom, either with their permanent or casual partners. We also conducted in-depth interview with our respondents, and it is still our big question. Is it ignorance or lack of self-perceived risk of HIV infection? Because many respondents responded like this: I don't regret of getting HIV infection. It is the risk of my job. I don't feel any change on my body. And some responded like this: some of my friends told me that I could die of AIDS. I told them that all of us would die, and they could die earlier than I would. This is the sperm-stroke correlation. There is a correlation, with a significant correlation with the level of education has been achieved, with type of key population, with knowledge and heard about HIV at first sexual intercourse, and awareness of HIV risk while having sex without condom. The sperm-stroke correlation analysis showed significant correlation between self-perceived risk of HIV infection while not using a condom during sexual intercourse, with level of education, knowledge of HIV, type of key populations, and a custom of using a condom. When we refer to Coates in 2008, he presented that highly active HIV prevention should be the comprehensive efforts between 4 programs, namely behavior change, treatment or antiretroviral or sexually transmitted infection, biomedical strategies, social justice, and human rights. Therefore, it is an urgent need to strengthen HIV prevention program, especially on the self-perceived risk of HIV infection and condom use, through a comprehensive approach of strict law, education, and counseling. Thank you.